A 62 years old man admitted with dull low back pain, abdominal discomfort. On examination, he is hypertensive and lower abdominal fullness is elicited on examination. On abdominal ultrasound, demonstrate hydronephrosis with intravenous urography, demonstrate medially displaced ureter. CT scan shows the aortic mass. What is the likely cause? That means here the all type of the diagnostic issue present, all type of investigation present there. First of all, the clinical feature dull aching low back pain, abdominal discomfort. That means there is a lower mass present. There is fullness on the examination, but the ultrasonography, what the ultrasonography shows, the ultrasonography shows hydronephrosis, and the ultrasonography, it shows the hydronephrosis, and the IVU, it represent the medially displaced ureter. That means there is the pressure from the lateral side. And the CT scan, it shows a pericolic mass. That means there is a tumor in the retroperitoneal space which present pericolic area. That means in the lateral area of the abdomen. So in the retroperitoneal space, that means the posterior part of the abdomen, there is a tumor. But we have to find out the diagnosis with this investigation. Here the options are abdominal liposarcoma, metastatic pancreatic cancer, abdominal aortic aneurysm, retroperitoneal fibrosis, and colonic cancer. So first of all, let's see the retroperitoneal fibrosis. The retroperitoneal fibrosis or Ormond's disease. It is the Ormond's disease or retroperitoneal fibrosis. It is a feature of proliferation of fibrous tissue in the retroperitoneum. And the compartment of the body containing kidney, aorta, renal tract, and various other structures. That means the retroperitoneum. In the retroperitoneal space, commonly found the kidney, aorta, renal tract, and some other important structure. And here important that is there any tumor in the retroperitoneal space. As the retroperitoneal space is the very smaller area, it may compress the kidney, it may compress the aorta, it may compress the renal tract, which is the ureter, and other structure present in the retroperitoneal spaces. And what is the presentation? Presentation may present the low back pain or kidney failure, hypertension, deep vein thrombosis, and obstructive symptom. So different type of this symptom present in case of the retroperitoneal fibrosis, because it may compress the ureter, it may compress the kidney, it may causes deep vein thrombosis by compressing the inferior vena cava, and it may cause the obstructive symptom, and it may also compress the abdominal aorta, and it is usually present of the lower abdominal pain. And on the examination, we find there is a lower abdominal fullness. So retroperitoneal fibrosis, it is named after John Kelso Ormond, who rediscovered the condition in 1948. And what are the diagnostic modalities? The CT scanning of the abdomen. The biopsy is usually performed to exclude the other disease. The biopsy usually exclude the other disease, and treatment include the steroid, occasionally surgery, and ureteric stent insertion in case of the ureteric obstruction. The retroperitoneal fibrosis is uncommon condition and etiology is poorly understood. So retroperitoneal fibrosis usually very less. Significant proportion of the ureter are displaced medially because it present in pericolic ureter and it displaces the ureter medially. So normally what happen? Normally this is a kidney and ureter going on. Here we can see this is a kidney and ureter going on. And in case of abdomen, what occurs? In case of the abdomen, what occurs? In case of the abdomen, as there is a pericolic area, that means the fibrosis occurs in this area. So what it occurs? It causes the compression of the ureter, and finally the ureter displaced medially. Most retroperitoneal malignancies are displaced laterally, but in case of retroperitoneal fibrosis, it is displaced medially. Hypertension is another common findings. CT scan often shows a paracolic or para-aortic mass. So in case of the para-aortic mass or paracolic mass, it usually presents the retroperitoneal fibrosis or para-aortic mass. Actually this area, it should be removed and discussed again, that in case of the, here we can see this is the kidney and ureter, and the abdominal aorta, it passes between the kidney and ureter, and the fibrosis occurs the either side of the aorta, and it, when this fibrosis contracts, it also pull the ureter medially on the both side. So actually it present in the para-aortic area, not paracolic area. So in the case of the para-aortic area, as the retroperitoneal fibrosis occurs, so it contracts the surrounding structure including the ureter, and ureter displays medially. So it is the retroperitoneal fibrosis. And other option here, such as the abdominal liposarcoma, we cannot say it is lipoma, it is liposarcoma, it is fibrosarcoma, and it is other malignancy without histopathological examination. And here we can see there is the ultrasound present, ultrasound, there is the intravenous urography present, and CT scan present, but there is no histopathology report, so it should not be go for the liposarcoma. Also in case of the metastatic pancreatic cancer, so without histopathological examination we cannot say it is the pancreatic cancer. Abdominal aortic aneurysm, the clinical feature of the abdominal aortic aneurysm is different from this, and it is usually in the CT scan it is demonstrated, but here the CT scan shows the peri-aortic mass, not the aortic swelling. And the colonic cancer, it is also not true, but in case of the colonic cancer, there also we need the help of the CT scan and also from the histopathological report. And here the CT scan shows the peri-aortic mass, but the colon usually not present in this area. So the answer is the retroperitoneal fibrosis. And the retroperitoneal fibrosis, this fibrosis occurs on the side of the aorta. That means it is centrally placed. Most of the retroperitoneal tumor occurs laterally, but here this is the medially.